The COVID vaccine rollout is raising questions about returning to the workplace and whether companies can require or will require workers to get vaccinated. That was one of the questions that asked in CNBC's Workforce Happiness Survey. Rahel Solomon joins us with the results. Good question, Rahel. Good morning.
Hi, Joe. Good morning. So, yes, our new CNBC and SurveyMonkey Workforce Survey took a look at the attitudes that working Americans have toward the COVID vaccine. Now, overall, 57% of working Americans support their employers requiring a vaccine for workers before a full reopening. There is, however, a divide between those who are working from home and those in the office. So 68% of people who are working at home support a vaccine requirement. Compare that to 54% of those working from their usual workplace. Also, Americans of different races have different takes on requiring a vaccine. 87% of Asian workers support a vaccine requirement. Compare that to 63% of Hispanic workers, 56% of black workers, and 55% of white workers. And overall, nearly 80% of workers are confident that their organization's leadership is making the right business decision to manage through the current environment. That is, however, down slightly from 83% in May. But those who are not happy at work feel differently. 57% of those who, quote, wish they had a different job do not have the confidence that their organizations are making the right decisions to manage in this current environment. But, Joe, this question about whether employers can and perhaps will require employees to take a vaccine is likely to be quite the debate in the months to come.
Yeah. If I was on a debate team and they assigned a pro or con, I think I could do either, kind of, Rahel, you know what I mean?
You can make the case for either, I think, but it looks like for employers who want to require employees to take the vaccine, they're having some big wins and some support to suggest that they can, in fact, do that for the health and safety of the overall workforce.
You just and then you go take it the next step to whether the government could mandate anything, and it becomes even stickier. And then you can see where the personal liberty types that would say
it's a tricky issue.
And you know, in the past, you know, there's whether there's data to back it up or not, vaccines have been controversial in the past. So, you know, the polio vaccine, there was initially something in there that if it had been, if it could have infected human cells, it would have been a really bad thing. SV40, a simian virus 40, which luckily it couldn't. But you know. And then there was a swine flu. Remember, there were some long-term side effects from a vaccine from that too. So that's why
vaccines have long been controversial, yes, and perhaps even more so because of the expedited process with the COVID vaccines. But you know, public health crisis amidst, and so
I'm coming down on you know, it's you can smoke as much as you want if you want and give yourself, but you can't smoke on a bus. I heard, you know, where I got that? George Clooney, of all people, was saying that yesterday. But you know what I mean? If it's affecting other people, then it matters. So you're talking about the safety of others. So you need to get, we need to get everyone vaccinated to get to that herd level.
Shepard Smith here. Thanks for watching CNBC on YouTube.